you at this point. So I'm just hoping that he does remember.
We have Dr. Mahabir in line now.
Okay. Good afternoon, Dr. Mahabir.
Good afternoon. You sound a little faint.
I do. Am I sounding a little better?
A little bit. If you can make it louder, it'll be.
Anderson, you can do something to make me sound louder?
Yeah, adjust your volume. Go ahead.
Okay. Are you hearing me better?
Yeah, that's better.
Okay. So, Dr. Mahabir, thank you for coming, and thank you for Sarah for making arrangements. So, you're an ophthalmologist, yes?
Sarah for making
arrangements. So, we want to talk in terms
you're an
ophthalmologist, festivities particularly.
Right.
And so, we want to talk
we are in a tropical country, so we always
festivities particularly. And there's an assumption that we may be exposed even more, those people who will be on the road to the sun, and how eyes should be looked after.
Well, it's always worthwhile wearing a pair of shades. There are two major things that the sun is alleged to have to cause two diseases. One is pterygium, which really is the growth across the eye, across the what appears to be the brown part of the eye, from the white. That's the pterygium, and that is related to chronic irritation from sun and dust. That's one. And the second thing is that there is some evidence to suggest that exposure to sunlight increases the risks of cataracts.
Okay, I thought that was a fact.
Yeah, well, lots of things are taken as facts, and yeah, I think we should accept that.
It's more or less so.
More or less so, until contrary evidence. But these days, you never know how things go. It depends. Whose interests we're dealing with. Anyhow, that's beside the point. Those are the two major things. Those are the two things, really. Sunglasses will also prevent things like, dust getting into the eyes and stuff.
Yes. But, okay, so, ordinary sunglasses will do that, but ordinary sunglasses won't protect you from the sun.
Well, yeah, you need a UV, protection. That will help. But by and large, most sunglasses will give you some degree of UV protection.
Is that so?
Yeah.
Okay, well then that's...
And they don't have to be tested as such, they can be, purchased over the counter.
Right. But do they have to look a certain way? Because you always hear that you're supposed to you're supposed to go right along the corners of the eye and all of that.
Well, the broader it is, or the larger it is, the less less sunlight will get into the eye. But the major part really is the central, the front of the eyes. As far as looks go, from that point of view of protecting the sight, it's not that important.
Okay.
But again, it's a matter of style and the patient. Really.
You're very indulgent.
Well,
you don't insist.
No, I don't think I certainly don't think that it's necessary.
Right.
It's more style than some medical benefits as such.
Okay. And the disease you spoke about, pterygia, what you said? What it was? The one that
pterygium.
Pterygium. What is that exactly?
That is really what in a practical point of view from us. To simplify it, the conjunctiva, which covers the white of the eye, it tends to grow across, usually at the 3 o'clock and 9 o'clock position, in the part of the cornea that is exposed most. The upper lid cover the upper part of the cornea, and the lower lid cover some of the lower part of the cornea. What we see when we look at the eye is really what we see as the colored part of the eye is really the iris, which is not really the outermost layer of the eye. That's inside.
Okay.
It is covered by the cornea.
Yeah.
And part of the cornea, upper and lower cornea, are covered with by the lids to some extent. The area that's exposed when we have our eyes open is the central part of the cornea. And quite often we get these pterygia growing. It appears like the conjunctiva, which covers the white of the eye,
the
sclera. extends over the colored part of the eye. Usually it is nearer the nose. 80-90% of them will be on the nasal side, near the nose. Some of them will be on the temporal side, which is really on the outer side. But it's really a growth of the conjunctiva, if you like, that extends onto the cornea. And it's fairly common. If you look at 10 people, 1 or 2 of them would have some degree of a pterygium. Especially in the tropics, where the sunlight and the dust and so it's probably much more.
So somebody looking at this person, what they will see? Them squinting
or something? The brown part of the eye, or what appears to be the brown part of the eye, covered by a growth.
Okay.
With blood vessels on it.
Right.
It usually starts from the periphery. The periphery being where the white and the brown part of the eye seem to meet.
Right.
And extends towards the pupil.
Right. Okay. So that is different from cataract that will cover
cataract
the lens.
Is different,
yeah.
Cataract is inside the eye. It's actually, the cataract is actually the lens in the eye. We all with a lens.
You're right. And the lens grow old after a while, it get opaque.
With time and with age and with exposure, it gets cloudy.
Right.
Normally it's a crystalline clear lens that the light comes through undisturbed. Well, it's when it becomes cloudy, then the light cannot come through, and therefore the images that you see will not be completely clear. It may be blurred depending on the degree of cataract that's present.
So folks on the street, Dr. Mahabir, will, the sun is a factor, dust, everything, things can happen like, I know one person who lost his eye through a fight in a steel band, like glass bottles, and so the shades will protect as well?
Well, it would, in the sense that it's a physical protection. I mean, if you're hit in the eye and you have a pair of sunglasses on, then it's less likely to be transmitted or transmitted to the same amount of force to the eye.
Right.
And it's the force to the eye that will damage the eye, will rupture the eye. If it's, of course, a bottle that's broken, if there's a sharp edge, well, then, the risks are much, much higher.
Yeah.
So basically, sunglasses will help to some extent, in as much as, it will provide a physical protection in front of the eye. The best thing, though, is not to be hit.
And I say, people probably can even get chemicals in the eye. They, if you do get something in your eye, like a puncture, so what's the first thing you should do?
If it's punctured, which means it's ruptured, you want to just leave it alone and get to the hospital.
Right.
If it's a chemical or so, or if it's just dust and so,
you can rinse.
You can rinse it with just plain tap water or bottled water, whatever you have. But if it's a chemical of some sort, of acid or alkali, you don't want to try and neutralize it. You just want as much water as possible poured into the eye.
And then see the doctor.
Then see the doctor,
Okay. When you say you don't want to neutralize, what you meant?
Neutralize in the sense that if it's an acid, some people may say, well, I can neutralize the acid with an alkali.
Oh.
If it's an alkali...
You mean play chemist?
Play chemist, which will cause more problems.
Right.
Than,
just wash it out as much as you can.
Yeah, water is all you need, and the closest water you can find, just use that. Whether it's a tap or whether it's bottled water or whether it's not dirty water, though.
No. I should think not. Yeah. So what other sort of things you think people would meet up in a festive season like this? What about not wearing your seatbelts? In Trinidad, it's not a law that you're supposed to wear seatbelts in the back seat, but you could get injury to your eyes by not using seatbelts, and you get a lash.
Yes, well, not many people obey the law. The law is that you must have the seat belts on if you sit in front of the vehicle. What happens really is that when the car is traveling at 40 or 50 or 60 miles an hour and it hits an object, you are pitched forward at that speed.
Right.
And most of the injuries is really because you hit your eye on the steering wheel or on the dashboard or something like that. And that can happen in the back seat
as well,
You can hit the front seat. So really, you need to wear your seat belt once you're in the car. It's not just the eye injury. There's severe head injuries that occur, and chest injuries that occur because people don't wear the seat belt.
Right.
And if they did, a lot of them would, not only would the injuries be less serious, they may get away altogether from being injured. So wearing the seatbelt is very important, and it needs to be enforced a lot more strictly than
it is. Right. So we hope that people will listen to your doctor and wear their seatbelts. But in case you get a lash like that to the eye, what do you do?
Well, if the eye is ruptured, a lash like that, you need to see
an ophthalmologist.
You need to go to the hospital, or you need to see your private doctor, but you need to have it assessed to see whether the eye is ruptured or whether it's a superficial injury or what's happening. You can also get injuries in the eye, fairly serious injuries from injuries, from trauma that has not ruptured the eye, sight-threatening injuries. You can have bleeding, you can have inflammation, and so from the injury. So, those are things that that you really need to have it assessed
as soon as you can.
As soon as you can. Now, a minor blow or just a little blow to the eye, I wouldn't say you shouldn't have it assessed, but it's less likely to have caused,
but do you do anything? Do you do anything?
Well, depending on what it is. What do you mean? Is it what the doctor would do?
No, if something happened, you hit your eye for whatever reason.
You see the doctor?
Yeah. No. Immediately, do you have anything to do?
If it's an injury in the form of something blowing into your eye like dust and so, you can wash it off. If it's something like getting into your eye like chemicals, you wash it off.
Yeah.
But other than that, if you do not know what has happened, if the eye is ruptured and you throw water in it, you may cause further damage. So it's important,
Right, to keep hands off.
Yes, it's important.
But Dr. Mahabir, I don't know if... Anderson, can you tell me what time is it, please?
It's just about 17 past.
Okay, so we have a few minutes, Dr. Mahabir, and we have seemed to have covered all the likely injuries. And
what about alcohol?
Oh, okay. You mean taking too much can damage your eye, or your behavior will be...
The behavior, people get a bit short-tempered if they have had a few and they drive under the influence. Alcohol, I have no problem with alcohol in moderate amounts, small amounts. But I think people who are driving should refrain. I think the law is such that you really need to have a designated driver.
Yes.
And that's as far as alcohol go. I think this is one of the times when smoking may be,
not an issue?
Not a major issue. not at this point in time, except for fires. But smoking on your health is obviously...
not good.
Not good is putting it very mildly.
Yes. But, go
sorry,
ahead.
Go ahead.
No, you go ahead.
So the other thing about Carnival and, is the sexually transmitted diseases that need to be, addressed. So, people just have to be careful and, enjoy themselves.
Just have to be responsible.
Yes. Well,
yes, and
responsible, yes.
Making the correct choices. But Dr. Mahabir, the sun, and I know you said the jury's still out and whether it's causes cataracts, right?
Well, I won't say the jury is out. I think by and large people do say that, but you know.
But you're not as convinced as you are. Yeah.
But it's pretty well accepted generally.
Right.
The sun does increase the risk of cataract forming.
So how long have you been practicing as an ophthalmologist?
As an ophthalmologist, let me check. 77 to now. That's 23 and 15.
Wow.
38 years.
That's a very long time.
Well, I don't think so. I think there's a lot more to be doing.
Well, of course. But in your practice, these 30-something years, have you seen anything that would suggest that we have a high rate of cataracts, perhaps?
We do.
Right.
See, cataract is a funny thing. Not all cataracts have to be taken out.
Mm-hmm.
If you take a age group over 70, a large percentage of them will have cataract. That doesn't mean they need a cataract operation.
Right.
It does not mean that they are handicapped in any way or visually handicapped in any way.
Okay.
It does happen as we get older. And some people may have cataract for many, many years and not have to interfere with it because it hasn't affected their vision. It hasn't affected the way in which their visual function.
Mm-hmm.
So,
but for many persons,
I have a cataract and I must have it removed.
Right. But for many persons, they do have to take it out.
Of course, yeah, it's fairly common. And the incidence in Trinidad, yes, I would say it's a bit higher than
a temperate climate.
It does, yeah.
Yes. So
because we have more diabetes and more.
Well, we have that.
Yes.
Yeah.
Diabetes is
a major.
Will be a factor.
Yes. Yeah. So, Dr. Mahabir, so you find that over these years that you practice in ophthalmology, you find persons have become a lot more responsible in eye care?
There has been an increase, yeah. I think I know when I first started, the incidence from diabetic retinopathy, which is really bleeding in the eye from diabetes, was much higher than it is now.
Is that so?
They do seek treatment and accept treatment a lot more readily or earlier now.
Okay.
Which leads to much better results.
So, before, they would just go blind?
Well, they'll present pretty well blind, not all, but
a lot.
Too many of them.
Yeah.
Now, I think people are more aware. They do come in a bit earlier.
Yes.
Even with glaucoma, although there are people who present late, and so with diabetes too, bleeding in the eye from the diabetes. But it has certainly improved. All that doesn't mean we don't have some way to go still.
Mm-hmm.
They present earlier, which is very important. They need to be checked because the symptoms are very late. You can have significant eye disease in both cataract and with diabetes, bleeding in the eye, and not know.
Yeah.
Because
it would happen slowly.
It is slow and it is not, the symptoms are late in the disease.
Right. Yes. But I get the impression that there's a lot more diabetes in Trinidad than there was all those years ago.
Yeah, well, throughout the world, I think you can say that.
But
I think the incidence has increased, and the diagnosis also has, it's the criteria for diagnosis has also changed a bit. So, but it has increased throughout the world, and I think it's an epidemic that's occurring throughout the world and needs to be really, addressed. I think patients have to be more. They have to take care of their health. They have to take care of their diabetes. When they do find out that they have it, they need to check and make sure that whether they have it or not. And the same for glaucoma, which are the two major causes of
blindness.
Irreversible, blindness. Everyone says.
Sorry, irreversible sight.
Irreversible loss of vision from two of the causes of vision loss of vision rather than blindness. That is very much preventable.
Yes. So, Dr. Mahabir, I just want to thank you so much. Mahabir?
Yes.
Trying to say your name correctly.
Yes, I used to do that too.
Thank you so much for coming on. As you see it, a program from Pavi. Thank you very much.
Okay, thanks very much. Good.
Yes, bye. Okay, so that was Dr. Boysie Mahabir, and we hope you got a few little tips on how you can care for your eye and prevent accidents. And if you do get an accident, then you know what you can do to make sure that it doesn't happen, that it isn't worse. Okay? And the other thing is that we would like that people just have very responsible behaviors over the next few days and weeks. You know, just look after yourself, look after your health. So let me just take time out now and wish a very happy belated birthday to Sister